Wake in the trenches. Patient seen 2 days ago. 88-year-old woman, very sharp, very compliant. There's a history of hypertension, lipids, endometrial cancer in 2014, treated with chemo, cured residual neuropathy. February 28th, had a swollen left lower extremity and had a peroneal vein DVT. And evidence of old femoral vein DVT. Leg was swollen. Started on a Pixaban. She was on 5 a day. I continued it. I did not de-escalate it. I did not de-escalate it. I did not de-escalate it. Comes to see me 2 days ago. Left lower extremity looks more swollen. She noticed it. Get a stat duplex. She now has a left posterior tibial DVT. And she's taking a Pixaban. She's therapeutic on it. So the issue here is what to do. And why did this happen? This is a functioning lady. She did not want to go into the hospital. She did not want to wait in the ER. And this is a distal clot. But she failed a Pixaban, which is an oral factor 10A inhibitor, and it's one of the standards of choice. So one option is to switch her to low molecular weight heparin. In this instance, it would be Lovenox. Sometimes this is given for resistant clot. The problem is she refused to take injections. She did not want to inject herself, and probably with this, you'd have to inject yourself twice a day. Kidney function was normal. She was a candidate for it, but she would not take it. And this is a distal clot. Warfarin could not be given without transitioning. And that's a painful medication, adjusting the INR. And there's no evidence of working better than DOACs, except in some rare situations. So what I elected to do was start dabigatran. This is a DOAC also, but it is a different mechanism. It's a direct thrombin inhibitor. The bugaboo here is when this was studied, they had 5 days of low molecular weight heparin. And then they gave dabigatran. It's called switch therapy. And that's just the way the trials were designed. They were the Recover and the Recover 2 studies. But I figured she was already anticoagulated somewhat, even though she had this clot, and I just switched her to dabigatran. Hopefully, this is a good choice, but she wouldn't take Lovenox. And warfarin, I felt, would be too labor intensive, and this was a distal clot. The other issue is, why did this occur? Why? She clotted through therapy, so this is a resistant clot. So the two things you have to think of: malignancy. Now, she had a history of endometrial cancer. That's one of the less aggressive cancers, and it was cured, and for this to come back over 10 years later would be unusual. She was treated for it. And there's no evidence of any other type of cancer. Nevertheless, I felt this was an indication for a CAT scan of the chest, abdomen, and pelvis. Number 2, could she have the antiphospholipid antibody syndrome? And this is 2 flavors. It is lupus anticoagulant and anticardiolipin. Okay, lupus anticoagulant flavor has a stronger association with blood clots. The problem with that, she's already on therapy, so you can't order the test. I ordered anticoagulation antibodies and anti-beta 2 glycoprotein 1 antibodies on her. But they have a lesser association, and for her to develop this later in life, it's possible. Now, if she turned out to have this, then she'd need to be on warfarin and be a different ballgame. But these clot cases could be tricky, and this isn't straightforward. I'm hoping I get away with dabigatran, and for some reason, this was a Pixaban failure. Follow-up will be given if it's indicated. Hopefully she'll be okay. I'm also, in a week later, I'm repeating her ultrasound of her leg, and I'm going to keep a close eye on this. And that's it for today's In the Trenches.